Good afternoon.
Hi, Jen.
Hi.
And the air conditioners on the sun.
It's gonna be 91 on Thursday.
Which tomorrow, Tuesday.
Yeah, 91 tomorrow, 90.
Good evening. I'd like to open the Allenstown Select Board meeting of Monday, June 2nd. It is 6 p.m. and let's do the pledge of allegiance. Pledge allegiance to the flag
Flag of the United States Republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Yeah.
There's something in my ear.
I was present on the board tonight. Kathleen was here. Diana Nova, Laura Lambert, Trish Caruso.
John Harrington.
And who else is here this evening?
Yeah.
Ron Admiral.
Eric Lambert, Fire Chief.
Beth Howard, police chief.
Peter DeSantis.
Armin Verville.
Anybody online that would like to let us know who's here?
Jenna Partington.
Thank you. All right, do we have any citizens' comments? Now would be the time to speak those. If you don't mind coming up and
Yeah.
stating your name and.
Armin Verville. I'm just at your next meeting on the 16th. Will be at the old meeting house.
Excited, I'm looking forward to it.
It's not nice.
It's usually fun. It's pretty good, yeah.
Hopefully it's not as hot as last year.
Well, that's it.
It's hot.
The heat doesn't work well either.
Yeah, it's either hot or cold in there, for sure.
But anyway, I'll see you folks up there.
Yes.
Okay, very good, thank you for the invitation. Anybody else? All right, so we'll go into our regular agenda. The first item is the health dental benefit proposals. And John will lead the conversation on that.
All right, given that the topic, because of our default budget came up, of the recent rise in our insurance costs this year. The board began the discussion, when was the last time the town actually went out to look at health benefits? So I was directed towards NEPCO, which is New England Employment Benefits Company. I think I got that right. And they are a company that covers small towns like us and larger towns. And Jenna, who is joining us tonight, was able to put together an array of different opportunities or proposals that the town would look at to possibly offer different packages to employees to help them save costs against healthcare, as well as the town's portion, while keeping as close to our current benefit package as we could. And what I sent to you were two different options, comparing our current health trust coverage to two products done by Anthem Gold and a dental plan, two different dental plans comparing us to our current health trust dental plan. And the first thing I want to point out, of the two health benefits, the one that is down the middle column that you're seeing there, that one is closest to what we have right now. It covers all of New England. So if you're currently seeing a specialist in a different state, that plan would cover you. The benefit to the employee who may not need that level of coverage right now in their current life is that the third option is New Hampshire only, where they're seeing a PCP once a year, they don't have any ongoing medical issues, and they're looking to save a little bit on their healthcare costs. Of course, that would garner the greatest savings for both the employee and the town, depending on which choice the employee makes.
So if we went with this third option, the coverage that's in New Hampshire only, say we had an employee right now that was battling some type of illness where they needed to go to Boston.
The plan would be to offer both. So
Okay,
it would be an à la carte. Do you want to keep the all New England coverage? Or do you want,
oh, I
the
like
second,
that.
yeah,
I
they would have to- no.
I agree, cost savings, I don't wanna force.
No,
That's-
I would, they would have a choice.
Yeah.
Yeah.
Feel good about that.
One thing I would point out, if you don't mind, John, is that
Sure.
the New Hampshire network is definitely a lot less expensive, but it's very difficult for me to recommend to only offer this one plan option. I think it is best practice to offer the both plans, because now you're giving the employee choice of whether or not they want access to the Massachusetts hospitals, or if the New Hampshire network is going to work for them. And I would just point out that Dartmouth is a phenomenal hospital that is within the New Hampshire network. So there is a tertiary care hospital. No matter where, regardless of the plan that the employee chooses, they are covered as though they're in network for emergencies. So if you are in a car crash in front of Mass General, that's where you're going to go, and you're going to be treated as though you're in network, even if you've only chosen the New Hampshire only plan. The stipulation would be that all of your routine and your follow-up care needs to be back in the network once the emergency is resolved.
And for your company right now, I know Health Trust, risk pool has been a big issue. Do you guys have any issues like that, similar going on? Would we expect our cost share premiums, employees to rise substantially in the next couple of years?
That's a great question. We are not a health trust. We're an employee benefits brokerage, so we do not have a risk pool that we own ourselves. We represent the towns or our clients. So every year we will be going out to bid, excuse me, and evaluating the market, and all the insurance carriers that are licensed. Sorry about the cat. Sorry, it's only when I'm on a Zoom call. So, but in any case, we would go out to bid every year, and we will be evaluating the market every year to see what plans and benefit offerings are available to the town. So we don't just set it and forget it. We're working year after year with John to show you what the market has to bid for plans and designs and options, and then we make a decision from there. To answer your question about will your rates continue to go up, my magic 8 ball doesn't cover that question. We have a broken insurance system throughout the country, and until that is resolved, no one's really going to be able to answer those questions. What I can say is that there's a huge benefit for you to come out of the trust, because we can match up your plans pretty closely. They're not exactly the same. And that's why we wanted to give you the side-by-side comparison. But you can see there's significant savings just by coming out of the trust.
So I'll follow that question up with, was there a 3 to 5 year rate analysis of these companies that led to believe, this would be the best option? And was there consideration to rate hikes in the future?
So that's a really good question. You can't really do that with the small group health plans in New Hampshire, because they're all age banded, and it's not going to be something that is specific to the town of Allenstown. It's not, the increases would not be based just off of the town of Allenstown's experience, because we're a small employer. Small employer in New Hampshire is under 50 lives. So what I can tell you is that historically speaking, we see a trend of generally low single digits in terms of increases for the plan. That said, because we're looking at age banded rates where your premium that you pay is based off of the ages of your employees, if you have an older population, that's going to drive your rates up. And that's what's going on with the trust, to be very honest with you. Right now, the SAUs and the towns and the municipalities that are in the trust are the ones that only do better with their rates by staying in the trust. That's why the trust is actually going bankrupt, because the more desirable, the younger groups are coming out, and that's driving the rates up for everybody. So, the town is now shouldering the responsibility of the older population within that trust. I have an SAU up 89 that got a 65% increase from the trust, and when they came out of it, they got a decrease in premium also, just because they have a more desirable demographic, younger crowd.
I also understand that this could possibly take effect in July 1st. And that would set the year for July through June. Currently, our fiscal year and our health coverage year is January through December. If we wanted to keep that, do 6 months and then enter into a year, what would that look like?
So we can do it one of two ways. One, you can either hold off on making a change until January, and that's fine. And so that's one option. The other option is that you move to the plans in July, and then we reshop it out in January for you. So what I would probably do is say, if we're going to go with the July effective date now, then to keep things stable for employees, what I would recommend is that we don't entertain Harvard or United Healthcare, that we only look at Anthem, and that way we can just keep things stable for them and only do another open enrollment in January, not a whole nother carrier change.
Right.
But it's very doable.
Okay. I appreciate that you want to keep that stability for our employees. I think that's going to be a huge thing that, I know that they'll be looking at, where will their current primary care physician?
Right. Well, and to your point, right now you have an Access Blue New England plan, which gives employees access to all of New England. It does require that they have a PCP. It does not require them to have a referral. By offering both plan options, you are telling your employees that the first option is your network's exactly the same. No one needs to worry about changing PCPs. No one needs to worry about whether or not their specialist is in the network. We're going from the New England network to the New England network. It's the same. They would need to get new prior authorizations for prescriptions. If they have a procedure that's scheduled, they would need to get a new prior authorization for that. So there's those things, because they'd get a new ID number. But their doctors are not going to change. If they opt to go into that New Hampshire only network, then what I would recommend is that we do a PCP match. And that just means that if people want to call me or send me an email with who their doctor is, I can just check the network for them to make sure that doctor's there. Or I can send John a lookup link where he can provide employees with a pharmacy and a provider lookup to just make sure their doctors are in the network. So there's things that I would want to do in advance to just reassure employees, that to set the expectation. If they don't care who their PCP is, maybe the New Hampshire network plan is perfect for them, and we have one assigned. But I know I care a lot about my specialist, almost more than my PCP.
Sure. So it sounds like you would also come in and do an open enrollment information.
Yes, ma'am.
Yeah.
Yes, ma'am. I think that's really going to be critical, because it's very stressful. Nothing is more stressful to people than their paycheck and their insurance when it comes to employment. So I think it really would look good for the town to have us come in and do an education meeting. We can do it in person, we can do it virtually, we can do it after hours if spouses want to attend, and just be available to answer questions, review the benefit, probably use the same document that you have in front of you to just go over that. We would articulate what the HRA looks like. If you decide to choose to move the dental also, we can do that. So yeah, to answer your question, I'm not trying to be long-winded. I just, I've done this a few times, many times, and I just feel like with the change, employees are really going to be anxious, and the best thing to do is to say, here we are, we're being transparent, we're giving you the information, we're giving you opportunities to ask questions. And by the way, if you have questions after July 1st, we have people available to help you.
And one last question, with the current plan under Health Trust, the employees have access to a portal that allows them to, see records and maybe gain points for different types of things. Is there a similar type portal being offered with these plans?
Yes. So Anthem has every member, when I say member, every employee who's enrolled is going to be able to go into Anthem's website, create their own portal where they can log rewards points. They can, if you go for a certain cancer screening, you're able to earn points and get gift cards, all of those types of things. It's not something that's set up through the Health Trust. It's something that we would just do directly with the Anthem. And I'll provide them with all the information about how they need to do it. Anthem also has a really great mobile app that they call Sydney. I don't know if you're familiar with that or not, but it will allow you to download a digital ID card on the spot while you're at the doctor's office. You can look at claims right then. You can download EOBs. You can, there's a lot of different things you can do. You can use the telehealth providers through that app. So there's a lot of things that go into it, other than just the coverage itself.
I have a question about moving forward. So I understand right now, for simplicity's sake and to ease employees into this transition, we're just picking between these two, but moving forward, would it be possible to offer a high deduction health plan? Or maybe, like you were talking about that younger demographic, I know those younger kids, they would rather, and then they have the ability to use an HSA to supplement their retirement savings, which would, if I was younger, I would prefer that all day long. So I don't know if it's possible that we could offer
Absolutely.
that.
Yes, we definitely can, as long as we have more than 10 employees, which obviously you do. Anthem will allow you to triple offer. So we even now we could do that. I could just connect with John, or you can just tell me what amount of deductible you think would be a good idea, and then we can offer 3 different plans.
If we could, I would like to do that. I don't know what the demand will be. We do have a lot of older workers as well, but that younger generation, I would think would be all about that. My other question is more for you, John. So right now, our health, and I'm not sure, I think it's something the town does. The employees have an account, so they have their deductible. Once they meet, then is it 2,500 or something, they get reimbursed. Will we still offer that in conjunction with this health plan?
Say that again, I'm not, I don't know if I'm familiar with it.
Yes, I don't know if it was through Health Trust, but the way we had it set up, the employees, when they go for maybe specialist appointments or whatever, they may end up paying initially like $1,000 out of pocket, but then they get reimbursed up to 2,500.
2,500.
Yeah.
I can speak to that if you'd like.
Okay.
I could speak to that.
Well,
Thank you.
thank you.
Sure. So I was doing a little studying of the information Veronica sent me previously. So what I believe you're talking about is called a health reimbursement arrangement. And okay. So that's a pool of money that the town is setting aside just in case the employees need it. So right now you have $1,000 deductible on your health plan, which in the employer market, the small employer market, that's really, really low. But the town even goes further and says, okay, John, you pay the first $500 of your deductible related services. The town will pay the last $500 through that HRA. And it's for deductible services. So it's your inpatient care, outpatient surgeries, trips to the emergency room, high cost diagnostics, things like that. Your big ticket items are what go towards that deductible. It would not be used for office visit copays to a PCP or a specialist. So that's the way it's set up right now. It's set up for $500 per person, and it maxes out at a $2,500 benefit per family. So to answer your question, yes, we can still set up the HRA to work right alongside the health plan deductible. What we need to, and we can change that HRA if you wanted to. So if you wanted to keep it at a 50-50 split of the deductible, we can do that. But because it's the town's money, we can organize the HRA however we want to. So we can expand the employees' exposure, or we can minimize it, whatever you want to do.
Good to know that that option is there. Would now be a good time for us to talk about the employee buyback option that I had brought up. I know you had done some research. I know a lot of towns are doing it, and it really does incentivize people.
I found 2 examples from 2 different towns that I'm putting together for a proposal in conjunction with this.
Okay.
One has a percentage of a family plan, whatever the town would choose as the highest cost plan, up to 10% you would get if you chose not to go with healthcare. The other one was more of a contractual item where there was a set amount of money that the town chose, say
Okay.
$2,000 a year or $3,000 a year. That would be paid out at the end of the year last pay period.
Okay. I do know some places even do it quarterly or
Mhm.
semi-annually.
However you want to do it. But those are the only, there wasn't a lot of examples out there, but those are the 2 that I found.
Okay.
I used to get it in the town of Hudson, it was by the week, and there was $100 a week because we didn't take health insurance. It used to be $200 a week, but this is a new
Wow.
contract. Yes,
Wow, that's a lot. That's high.
yes,
That's a really, really rich benefit. We get $40 a month to not be on our company's health insurance.
Yeah, so with that in mind, do these 2 plans have a minimum participation requirement from, from the employee base? And if so, could this be problematic to that?
I don't think it's going to be. Anthem does require that 75% of your eligible employees be enrolled on the plan. That number is all of your employees that don't have coverage, somewhere else. Only when I'm on camera.
I don't sneeze.
She's a movie star.
She is. So, in any case, so we would need 75% of your eligible employees who do not have coverage elsewhere to enroll in the plan. So if somebody has coverage through a spouse, they don't factor into that equation. If they have coverage through a parent, they don't factor into the equation. I don't think you're going to have a problem.
Okay.
What about some companies, if you have a spouse each spouse has insurance? I know when I worked for one of the big companies, if your spouse did not take insurance through their organization, there was a surcharge.
Yep.
On the employee, because it was kind of like double dipping.
So that's called a spousal carve out. That's a step that I think is worth having more conversation about. And one of the first questions I would ask is, are you having any retention issues with employees? Because it will save money. What he's talking about is that if you have a spouse who is eligible for insurance coverage somewhere else, but is opting out of that coverage because the town's is better or it's more financially better for their family, then there would be a cost increase to that spouse for being on that plan because they have coverage elsewhere. In other words, you're trying to incentivize them to pick up their own employer's plan and take the burden off of the town. If you're having retention issues, then it's worth a conversation, but you might want to be cautious about that. Maybe that's something that we say, hey, employees, this is something that we're considering. Be prepared. It might be coming for next open enrollment, but I don't think I would hit them with it right now, especially if we're going to make a change from Health Trust. If we're making one big change now, I just, there's a balance.
And it seems like if we offer, and I would much rather offer an incentive, it's like carrot or a stick. I would rather lead with a carrot than a stick. That's a stick. I don't want a stick.
A lot of companies are doing that now. A lot of them. Yeah.
Well, and it does have a lot to do with recruitment and retention, and when you have carrots, your recruitment goes up. So Or the potential for recruitment is
Do you
increased.
currently have an opt-out for employees? In other words, if if they aren't taking the town's insurance, do you give them an opt-out bonus?
You
Like,
know,
you don't? Okay.
started talking about it.
Say again?
We just started talking about it recently.
Okay. We have access to a lot of benchmarking. Our company insures thousands of clients throughout the country. If you wanted, I could do some benchmarking that could compare the town to other towns in in the Northeast, and then nationwide, and you can compare your benefits and costs and those types of things to other towns, if that would be helpful to you. Unless, John, you've already got that data.
No, that would be helpful.
Okay, that might be something, I don't think that necessarily needs to be tied to the July 1st decision, but that might be a conversation that we have if you do opt to keep your January 1st anniversary. Like if we do shop again in January, it might be worth having a conversation where we can like really take a hard look at what other municipalities offer, and compare that to what the town is offering, if you are having recruitment issues and just want to know more about the buyback.
Thank you.
Sure. I just made a note of that. Okay.
It's meant just the conversation started, gives you some information to think about. At the next meeting, hopefully I'll have a couple of examples of different buyback plans for you to look at.
Yeah.
So we can institute both at the same time. We have a month to work on this before July 1. That would be an update to the employee handbook, where this would be an update to benefits.
Thank you.
So I would just comment, if you are looking to move forward for a July 1st effective date, there really isn't a lot of time, because my ultimate goal would be to try to have people's ID cards in their hand by July 1st. And I know we're on June the 2nd, but we would have paperwork to be completed and so forth. So you know, we can always do an August 1st effective date. What the last thing I want to do is have employees feel rushed, like, because when you rush things, people feel like you're trying to pull something off, and that's not what I want at all for you,
Yeah.
or as a new client of ours. So I
Do we
just,
have the buyback finalized before the July 1st, or could we move forward with this and implement that buyback at a later date if we need more research?
I would say let's save those things for January, because I really think that things like the spousal carve out, you're calling it a buyback. In my world, we call it an opt out. You know, and plus there might be some other things that I could bring to the table with, if I had some time to just kind of do a little bit of digging for you. But if we keep the January 1st fiscal year, so in other words, roll this out for 7/1 and then reshop it again in January, that might be the right time to roll out everything. Maybe we roll out some new employee paid benefits too, just to kind of really enrich what your menu of offering. This could be presented as, we're here to address a situation with the health trust. We're here to lower your premiums. This is what we're going to be doing from July to the end of December. And then in January, we're going to go through this process again and roll out other employee perks, for lack of a better term, and possibly some other benefits. This might be a good opportunity for you to survey employees and see what they would like offered. We did that recently with several clients, and employees were very interested in pet insurance, legal insurance, and cyber insurance. So we rolled that out. It was all employee paid, so it didn't cost the employer anything, but it was a direct response to what the employee wanted. So we can do all of that in January and give you time to evaluate it.
I think that was in the MRI thing too, wasn't it? That was discussed in the MRI.
I hear, I thought this is a big one too.
Thank you, Jenna.
You're welcome.
Thank you.
Thank you.
You're welcome. John, should I follow up with you tomorrow, or what should I do?
Yes, we'll talk tomorrow.
All right. Nice to meet everybody.
Thank you.
Thanks for having me.
Have a good evening.
And your cute little cat. Part of the show.
All right, any further discussion on this before we move on?
No, that sounds good.
Yeah. Fire department update.
Yes. Very cool, fire chief. Not a whole lot, just wanted to tell you about, still working on the roof. I got another quote sent John this week, and that's it for that. We have some changes. To employee staff, so as I said at the last meeting, one of the gentlemen who started with us not too long ago, finally got back to us and, is stepping away. So I haven't received his official resignation letter yet, but, I'd like to move forward with taking care of not policy side. This side of it, so when I get the letter, I can just move forward. And the second thing I had, and that was Mr. Nicholas Smallwood, he was supposed to have my letter by today, but he did not get it. So, he is stepping away. Also, our living student, Marcus Jordan Hazy, is now still in college, but is moving on, would like to just be a per diem member only and not be in the program anymore. He's on the verge of getting a full-time job offer because he got his certifications for Fire 1 and his EMT basic and Fire 2. So wants to stay us per diem, but also he's looking to start another job in the field, which is right now in our field is a very easy thing because it's a lot of openings for people. So I have a letter from him here just asking to be moved from a living student to a regular per diem firefighter. It's not gonna affect his pay rate or anything, it's just he's resigning from the program, so you guys know. So we will be looking, we did interviews to replace the living student for the year as the college year starts in September. So we usually have 2 students, we only had 1 this year. So we're doing the process right now and they're in the final stages of picking who would be there. So I will be not to work to discuss that when we get there. It's basically a 1-for-1 swap. There's one stepping away to just be a per diem with students. And last but not least, for the vacancy from Nicholas Smallwood, I have a gentleman who works at the mill, who is a already CPAT certified EMT Fire 2 hazmat technician who is moving into the mill on June 14th. So he would like to fill the spot that is vacated by Nicholas Smallwood, if you guys allow it. So that's pretty much it for that. So
Well, with the thought that we, elected to be in a hiring freeze right now, and we did recently provide an exception to the PD, but with the caveat that that would remain, the salary line would remain as
Yeah.
projected from the default deficit.
Yeah.
So I would ask the same of you, would that be the case with
it would
these
be
two
the case,
positions?
yes. So we're replacing 1-for-1, just like the PD. So.
Yeah, we haven't gotten to it yet, but I'm just wondering how the closure of the transfer station is going to affect our budget. Are we still going to be able to realize the savings from that?
I don't know, we have to wait for that meeting. I have no idea that you saw the letter I saw when I got it today. They didn't really tip their hand about what they're planning to do. The next step is just getting a meeting together between Allenstown, Concord, and DES. And then we'll find out what they have in mind.
John did inform me a little earlier that him and Chad have had some conversations about what if, what could be some of the,
Options available to the board to look at. If they come out with their foot down that you have to accept trash as a transfer station, what would be some options we have? So Chad and I are trying to come up with a plan B and different options that we can look at.
Do we reasonably think we can do it without any impact on staff?
Again, I have no idea how much they're
My concern with allowing you to fill the position is I would hate to hire somebody and then have to turn around and lay somebody off or decrease hours or make it
So,
any change like that, depending on what happens from these future meetings?
and these are per diem people, they're not, so these would be basically per diems.
Okay, both of them, I thought one of them
No.
was gonna be per diem and one is coming in as a full.
No, they're all, so Marcus is a per diem already, and the other two, the student is basically. The students are there for education and they actually work hours to be able to stay at the station. So they only get paid minimally on a call they might go on, for certain things, and then the per diems is exactly this, and they might be there for a shift a month.
Yeah.
They might be there for 2 shifts a month, they're not, it's not a guaranteed position.
Yeah,
So-
okay, well, that changes things, because
Yeah.
I did think you were talking about it full time, and
Oh,
I would hate to hire somebody and then say, oh, we didn't read our budget correctly.
yeah,
Can I have that in front of me?
there can be. So the first one is Marcus Meyer, and the second one is Mr. Rob Masters.
Thank you.
So Eric, regarding the roof, do we know if the insurance is gonna cover that or?
I have not gotten any feedback as to what it is, John's probably had more conversations than I had, I dealt with the adjuster. I've submitted a quote to the adjuster, I have not heard from.
And we won't hear anything until the adjuster gives us its report.
Yeah, and they've been working with the solar company, because they have a third party roof company that'll come and look at it too. They did sheathe it, underneath it, and to stop the leaking, which they checked yesterday and it didn't look too bad, but it doesn't prevent the soft spots in the roof, so as you go along with snow load and stuff like that. Just waiting to hear, that's why I say, insurance is sometimes fast, that's all.
Typically with Primex, the way they operate, they'll assign an adjuster. They'll go out and get different quotes if there's emergency services that need to take place right away, like a flooded basement, you need to have. A company come in and dry the floor and put in fans and they'll pay for all that as part of the claim. And then once they reach a settlement of who's gonna do the work, what the total amount is, they'll do a workup. They'll take out your deductible, which we'll be responsible for, and then they will likely ask the vendor to bill them directly. And that's how they'll cover it. So this is following the typical claim.
Yeah.
We won't hear until all of this is done.
I'm trying to help them move faster, so we're not putting a roof on, or
Yeah,
that
would be
not be fun, so.
But the adjuster's been,
He's pretty good.
yeah,
We had some more October's lately.
so as soon as we have an idea, you will, you know.
What's the beginning rate for this?
It depends on their certification experience level. So, on the wage scale, they fall in a wage scale where they fit. When it comes to their experience level, time on the job. So the newer ones like Marcus, who started with no experience, he started at the no experience, and as he graduated to fire 1, fire 2, and on those things, that's what he graduated to. Somebody of Rob's experience, who's been a firefighter for some time, might fall not on the first step, he might fall on the third step.
So you haven't set a procedure for either?
I haven't yet, and that's why I wanna bring the payroll form, I wanna make sure he's approved before I put the whole payroll change, because I know that there's discussions before.
I think we would like to know what that is when
Yep.
in the motion,
Yep.
so.
And I guess
So
that-
talk on that until you can give us that,
I can do that.
okay. Thank you.
It was this, I just got told about Mr. Smallwood, so I'm not in the office today, so I didn't, but I grabbed the people, geez, so. And that's it, that's all. I think that's it. Thank you.
Thank you.
Yeah.
Chief Howard, do you have something that you'd like to talk with us about?
Not tonight.
No,
No.
okay. I gotta give you opportunity now. before
I
we
appreciate
go
it.
to The PA's report. All right,
Congratulations
for being here.
Thank you,
Pleasure to
Yeah.
have
appreciate it.
All right, John,
All set.
you have the floor.
Okay, first item up, there was some discussion about a possible plaque for Mike Starr. To denote his time spent in town and in service. I don't know how the board felt about that.
Aren't there some in the lobby for past chief?
There is, it's generally just like their pictures, like a picture with like a sleeve, but not like plaques.
Okay.
So you're talking about doing like a plaque, you know, thanking him for his years of service and.
Oh, is it
Like,
like to him?
yes,
Not
yeah,
something
yeah. No,
hanging in the.
Yeah, I mean, they'll probably do that at the
Oh, okay.
PD anyway, but like,
Well, I
you know,
hope so.
crown trophy.
It's already up.
I was like, why did we take out?
Like crown trophy, you get a nice plaque and with
Yes.
his name and, you know, thanking him. We
Yeah.
looked it up, they've got some for PD and, you know, the badge type thing.
I know they did something for Mark Boger recently when he retired from the highway. I'm not sure how it was handled. I don't know. If we have an account for the town, I think they did combination. They did something that the select board sponsored, but then it's kind of together. They bought them a watch or something, but I'm definitely in favor.
Okay, well, we can certainly do the legwork and the research and find a day to present it to him. Okay.
Yeah. Right.
Just to keep the board appraised, the Boys and Girls Club is going to be putting up a shade structure in the back of the building. It's more of a canopy type of thing, it's free floating on top of the ground. The concern was, of course, digging into the ground on that particular site. Brian and I met with the contractor. Brian approves of the design that they're planning on putting in. And it would be for a couple of picnic tables, just to have some kind of shade out in the back area. It gets to be pretty warm in the summertime.
I don't blame them. I understand why they want it, but when it blows off due to high winds, who is gonna have to go down there constantly, as I said?
And I'm also wondering.
It's going to be anchored into concrete with bolts. I mean, it's not gonna be free floating. It's just not.
Because
gonna
they
be-
put the triangle one.
No, this is gonna be wood structure with roof.
Oh, like
And
a
we're
Rustino
actually-
type thing.
Yes.
Oh, okay,
Yes.
okay.
I was thinking.
I'm just
Fabric
concerned,
thing.
not that I don't
No,
want them to
wasn't
have.
wasn't the shale type
Yeah.
thing that you're thinking of?
Mhm.
No, this is a wood structure, but more of a carport structure, they don't have a name for it, they call it a shade structure,
Okay,
where
but we will be responsible for the maintenance of this.
it would be part of the facility now. They're paying for the installation.
Okay. Well, it does sound like a better installation than this picture.
Yes.
The guy's getting called weekly for, the tarp is down the street.
I mean, I'm not an expert.
The fire station.
I also think that this would not.
Find out what it's worth.
That's our insurance cost.
All right, sounds good to me.
Those of you who visit the website, frequently may have noticed there is a small new feature. The text my gov widget is now present.
Awesome.
That will be online June 16th. We're working towards that. There's promotional materials. If you click on the button, learn more, it'll bring you to a new page that has been set up on the website with different promotional ideas.
And will the PD be able to advertise it for us on your sign?
Yes, once we can actually use a sign.
Is it that bad right now?
It's just, the connection to it isn't working, so we can't update it, like we had new playlists ready to go all last week for the chief and we just couldn't play it, so.
I've heard that is common when they first get installed though, there's it's just like an update.
Is that why there's that blank?
Yes, that's a separate issue, but yes.
Yeah.
Well, whatever you learn, I'm gonna be picking your brain.
I can do the tutorial videos if you'd like.
No, I don't think you.
Might work.
As part of the text my gov package that the town purchased, we automatically received approximately 2,600 local phone numbers. So people are already in the database. This was available as public information, and that group will initially get, along with anybody else that opts in, a welcome message explaining what the service is, directing them back to the webpage to understand.
Their phone numbers are private and not shared though, right? I can imagine that may be a concern, some people
Right.
receive this.
That is only kept here within the town, within this system, it's not shared. And there is, of course, an opt-out feature immediately, if this is not something you want to participate in, it's very clear how to do it. You type in stop and you will be out.
And there's no dangerous sale of information.
No, we're not selling it.
And hopefully neither is the company that's running the program.
Well, they purchased it from a third vendor, so whoever collects those numbers already have the numbers, we're passing that. And that's it.
I have something real quick about the business then. So I had spoken sometimes back about our 457B plan that we offer our employees. Currently Nationwide is administering that for us. They are pretty high in fees for people that use that now, which is great, and I think our numbers have actually gone up since last time I checked. But we can we could switch providers to Empower, which offers a lower rate. I mean, it's a fraction, but over time that adds up. And I do believe it's our job as the Board of Selectmen, even though we're not contributing to that 457 plan, we're just allowing employees to participate in it. I believe we have a fiduciary responsibility to our employees to make sure we're giving them the best options available. I don't believe it would cost us anything to make that change from Nationwide to Empower. And I've already spoken with a representative because when I was working at the state, we had Empower, so I had gotten that ball rolling. Recently, he actually was going through retirement, so his replacement recently reached out to me and is interested in meeting with us as a board, having the Empower representatives come and just talk over the pros and cons, you know, the differences between Empower and Nationwide, and kind of sell us on why they're better, but I'm gonna tell you they're better. So I think we should go with them. So I didn't know if you guys were interested in that. It doesn't cost us anything, it's just the only people that benefit from it are the employees.
Should we consider any others? I mean, I know you're
And
paying for that, but.
And I believe Empower really is the best, and when they come speak to us, they'll let us know, but they carry the state contract too. So when you start getting into numbers like that, they're able to offer just a much better competitive deal. Nationwide is wide, and they're beating them, so. Yeah, in my research, and again, this was like a year ago that I started that. They were definitely, they were doing, because I was getting really good returns in Nationwide, so I was very nervous about making a switch. I'm like, my accounts are rocking it, I don't know if I told you guys, but yeah, Empower was really great. A lot of the same features that Nationwide has, just you're paying less in fees to have your money managed.
Are you familiar with any other?
I am, I was with the state, and they do offer a good program, and as a municipality, you're able to invest in that with the pool of the state. So you're buying in much larger numbers,
Yeah.
Win-win.
so I can invite them to the next meeting.
Yes, and I think I did, I emailed
did.
Aaron back and I CC'd you,
Yeah.
okay, Aaron had been out, but he or she responded to me today, I could go. And then my next
It's
thing,
an old meeting house.
yes, and it doesn't necessarily have to be at that meeting.
Oh, yeah, I don't wanna go there.
Okay.
Yeah,
So that, here,
the next thing is I had from Plan NH came in 2016 and did planning charrette with us.
Yeah.
Plan NH.
Okay. Yeah.
And recently, one of the people that works there that I know reached out to me, and she was wondering what we had implemented from that charrette. And so I had asked John to send me a copy of it, and really, it was kind of sad to look through. We've done a little bit of it, but we really lost our way. It was a wonderful charrette, and again, it's been almost 10 years, so some of the things that, the goals we had then and the ideas that were identified may not still stand today. We may decide that that's not the direction we're moving in, but I would like us as a board to revisit that document.
Well, I was active part.
Yes, so, and just see if moving forward, I know right now being in a default budget, we're not gonna be able to take anything, you know, big on, but back when I was a broke single mom, I thought I was gonna be broke forever, and I started planning for when I would have money someday. So I think we should do that as a board too. We know we're not gonna be able to spend or do those things now, but times change, things are cyclical, and once we're able to start making progress, it would really help us to have a vision.
So you wanna revisit what they sent us, not do another one?
No, I wanna revisit
Because I know there's a price tag.
There is, yeah. I think it would make more sense to revisit what they sent us, see what still aligns with our current goals and objectives, and to be aware of that moving forward. So hopefully next year's budget, or maybe maybe not till the year after.
I do like that idea, and, you know, we have our master plan
Yeah,
rewrite
that
is
needs to be
coming up, and this
updated
would
next year.
speak directly to that.
Yeah.
So, yeah, I'm good with that.
Okay, sounds good. So, John, if you don't mind sending that copy to everybody else as well. And then we can just review that, and that's another, we don't necessarily have to discuss at the next meeting, there will be no bathrooms. I'm sure there's gonna be.
No, I'll put in that meeting.
We don't need to make the next meeting a matter.
There's a bathroom,
People sweating.
there's a bathroom, but it's 3 trees back.
And that was it for me tonight, I think. I'll remember something else when I get home.
Laura, do you have any other business that you
Just, do you want me to comment now about it? So the AES committee met, May 27th, it was at Senator Fire Station. I think everybody on the committee was there. Mike was late because he had police business to do, so totally understand that. So I basically went through that procedure that we signed off and said, here's how this is gonna work, here's who's doing what. You know, section by section, so people were clear on what they were supposed to be doing. It was open to the public, so there were a couple things, what's the next name? David, Leitch, made a comment, he was looking for like a specific communication section in the document, and I pretty much said, here's how we're gonna communicate, but there's no communication section, so I'm like, you know what, fair enough, I'll just put one in.
Yeah.
Just to make it clearer. And then, couple other, somebody was not happy because I selected 10 o'clock in the morning, so it's like, well, 4 of those people are paid employees that work day. So for the kickoff meeting, I wanted to make sure that they were there in attendance, so, then I handed it, it's gonna be going over to Melaine, I think she's gonna meet in the evening. And we may have to have some of those daytime people stay in the evening, I don't know how that's gonna work out.
Okay, that's.
Money wise, but, you know, depending on what the topic of conversation, she can decide evening or daytime or, you know.
I think it makes more sense for the evening because the public definitely, this is an issue that there is a lot of division.
Yep.
I think half the town, right now, without having that information, half the town seems to support us keeping and developing that property. Well, there is a large segment of the town that thinks we're out of our minds, sell it, get it on the tax list, not our books.
So I went through all of the attachments, there's 10 attachments. 2 of them are the agenda template and the minutes template, but there are 8 pieces of information there that are gonna be important for people to go through.
Good, yeah.
And do that analysis, and I've also got,
Was the SAU there?
Nope.
Was it representative?
no,
That's true.
no. Yeah, I think that was the only one that was completely absent.
Okay.
Yeah, you know, there's a bunch of information there. And I've got information I've collected, that I'll scan and send to the committee, but basically there's a school in Manchester that, was just purchased by a developer, and they're gonna put in 30 workforce units in there, so. Something to keep in mind. And I think being on the planning board, you heard this, July 26th, the state has voted to allow commercial properties to be converted into residential units, so.
But not all residential housing is bad, and there is such a housing shortage in the state right now, especially the younger demographic. I personally, and I'm not saying this, I wanna see what happens with the committee, I'm totally for converting it to a town hall if that's the avenue that we determine is the best for us. But there is a shortage of even like studio apartments for that younger generation, the 22, 23-year-olds that don't have family that can help them. They have no place to go, so having some type of housing that maybe is geared towards that demographic, I don't think Allenstown has anything like that. We have elderly housing, we have low income housing, we have our regular and housing.
Canal Street is,
Good portion of that studio,
is what?
good portion of it is.
With like the roof rent, yeah.
Everything's through the roof now.
Yeah, well, there are a lot of programs out there right now, housing wise too, and the work and project that Manchester is doing with that developer. They are using programs that will help establish this housing to meet that need. And in this instance, it would be a way that would be less likely to have an adverse impact on our tax rolls down the road. You know, if they were studio apartments that were here, or, you know, communal living spaces, maybe even shared kitchen, almost like dorm style or something, but I know there are a lot of younger people, when you talk about people being homeless, in Allenstown, we don't really see it here, but there is homeless. There are people that are sleeping on somebody's couch, they're living with a relative, just because they're not pushing a shopping cart around Allenstown, this is a problem that exists. And we may need to do our part, and again, I'm not saying that's definitely where we need to go. If we do this study and we find out it makes more sense to turn it into town hall and that we're gonna recoup those rents and it's gonna be a better benefit for our taxpayers in the long run, I'm definitely all for that, but if we discover for whatever reason that that's not a viable option for
But from the
us.
planning board standpoint, you need to be very cognizant of the legislation that's coming down.
Yeah.
It's also falling on the emergency services.
Yeah.
They're trying to take away a lot of local control,
Oh, yes.
which is really scary on our part.
That, and it's a catch-22 here again, but so many localities are trying to block housing as much as they can, so
Right.
kind of this for that, if.
Well, the problem is you don't want to turn into a Boston sort of, or a Southern New Hampshire where you have houses 40 feet from one another. So, I mean, there's all kinds. You got the character of New Hampshire, et cetera, so
And it's your.
it's a tough situation.
Well, there's definitely a state plan in place already, Manchester and Concord and Nashua, a couple other towns are basically piloting these things right now. But, you know, there was a statewide study and a determination of, you know, we start here, we, you know, start with the bigger cities and towns and work our way down. You know, Allenstown would probably be, you know, bottom of the list,
Yeah.
town, right? But the goal is to meet that need for.
I believe they said we're 90,000 units short. And one of the things, if you watch New Hampshire Business on Sunday morning with Fred Coker, you'll see they've had a couple things on there that they said it's gonna be tough because central New Hampshire is already jammed, population wise with a lot of this stuff, so they don't know how they're gonna get there. The state can say what they want, but you can only put so many postage stamps on a letter before you end up overlapping. So there's some challenges coming, and maybe some of us won't even see them, because I think you're looking 10, 12, 15 years down the line, because we are the second oldest state in the country, next to Maine, so.
And well, and the other tough thing, again, is when we think about housing and the strain and stress that's gonna put on the services and the tax bill in general. I think a lot of times people do think of it as blocking newcomers, like protecting the people that are here. But it's our own children and grandchildren, it is us that we're affecting by refusing to expand our housing.
Well, a lot of the dynamics is what you have for tax base too.
Yeah.
When you look at, you say you go over to the town of Hooksett, well, they have immense amount of industry.
Yeah,
So, and that plays a part in where your tax rate is. Unfortunately,
yeah.
you're a product of what you can take in as far as industry. I mean,
But they have also, gone to the state and gotten funding for housing.
right, but they have an immense industrial commercial base in Hooksett. With the GEs and, you know, all of the big manufacturers that we don't see, all 28 bypass. Again, that Bearbrook State Park is for us,
I mean, we just have to
it's
keep in mind,
tough.
it's nice to do our share with housing, but we can't flip the table so that
Of
we
course.
overly tax burden the people that are already here too.
Yeah.
That's gonna be a delicate balance, we already have, you know, the houses versus mobile homes, right? And we know houses bring in, you know, our tax higher than mobile homes, you know, that's
Yeah.
probably something, you know, we certainly didn't realize that 60 years ago when we put those in. So, I mean, that's a challenge, I mean, nothing against the people who live there, but it's a challenge bringing in tax money.
Yeah.
So we wanna make sure we, you know, stay on balance and not tip those scales and, you know, drive other people out of their homes,
Yeah.
right, so. I know.
Well, the other impact
It's gonna be tough.
is our school budget. So what we do here goes over to the school. So you put 10 kids in the school system at $28,000 per kid or per child, and then PA is 16,000 plus. So you know, what do you collect for taxes versus Because they come running here and looking at you folks saying, why did my tax bill go up so high? Well, 33% of your tax bill, that's all that covers the town. That other 66% covers your education funding and your county base. So it's a problem statewide. We're not the only ones. It's tough.
It is.
It's a nail biting challenge.
Yeah,
is
I
what it
mean,
is.
25 Canal, when they came in to the planning board, one thing we asked them to do was give us a study of how many kids you are most likely to be in that environment, and they did the study, and they said, we're really not geared for kids, and it's more like adults, right, like professional adults. So I don't know what the latest numbers are now for children living there, but I heard they're way higher than what they told us.
Yeah.
Because what's happening,
Well,
I think.
back then, there wasn't quite the housing shortage that there is now.
Well, of course, though, I mean, but what happens is people, so they've got like 2 or 3 kids, whatever, their youngest one is like junior or senior in high school. They sell the house, rent an apartment as soon as the kid's out of school, so yeah.
Yeah,
I
and people are,
personally know somebody who did that,
people are doubling up their kids in bedrooms and so forth, because the cost of housing is not conducive to the earnings that they have.
and there are kids, people with young children too. When I worked in the town clerk's office, they were coming in, that's when they opened up and they were coming in like daily to register their car, we would have 2, 3 people a day. And they were like, people with small children moving in there, getting out of the cities.
Is there a next meeting scheduled for?
Yeah, it's June 10th. It's June 10th at 6 p.m. at the Allenstown School. If anybody wants a tour of the school, 10:30. Because we didn't have any place to accommodate that group, so.
Well, that was nice of the
Or at
school
school.
open up and let us leave there.
The elementary school?
Yeah.
Hey,
Yes.
It's our school. It's our school. It's the town school.
yeah.
AES.
I'm gonna get confused, like all these schools.
Anything else, Diane?
No.
Laura, do you? I did wanna ask, is there somewhat of a plan in place within the different departments of the maintenance of the electronic sign? I'm thinking once they're all up, there should be some coordination between the 3 locations as to what information is going in those places. Do they all have the same
Haven't
information?
gotten there.
So we'll move into the consent calendar minutes and manifest. So I'm gonna make a motion to ratify the consent calendar of June 2nd, 2025.
I'll second.
All in favor?
Kathleen, aye.
Diana,
Laura, aye.
Chris, aye. And then I'll make a motion to accept the minutes of the public minutes, meeting minutes of May 19th, 2025.
I'll second.
second by Laura.
I do have a couple of edits that need mentioning. Under the AES study paragraph, it should be ad hoc, not, I think it said ad hoc.
Oh, is that what she's
Edit there. And then I would ask that under the paragraph for the PDC that we include that there was a confirmation that the earnings would fit into the current budget, projected budget for earnings. But that's not stated in there, but I would like to have that included. That was part of the conversation.
Sounds good.
So, I make a motion to accept the minutes of May 19, 2025 of the edits mentioned.
I'll second. Laura.
All in favor?
Kathleen, aye.
Diana,
Laura.
Tricia.
Making a note right on the signature sheet.
Yes, I will. I'm gonna get on to something else. If we have something we can pass along, I can make those notes on people are signing. John mentioned that there was a correction for the May 5th minutes in his email to us. Under the appointment of treasurer and deputy treasurer, it was kind of worded a little bit off. It says a quarterly stipend of $3,430, but that's really
Yearly.
the annual amount is $3,430 and it'll be a monthly stipend. I just want to make a motion that we accept that correction.
Okay, so
All in favor?
Kathleen, I.
Diane,
Laura. Tricia, aye. Evan has given us a land use change tax for map 406 lot 11 gravel pit. I'd like to make a motion to accept the land use change tax in the amount of $16,990 for that property.
I'll second.
All in favor?
Kathleen, I.
Diane,
Laura,
These are just me and Kathleen for each, right? Do you need somebody to officially swear us in? You have Diane here.
Any of the board or I?
Okay, so we do that after. Minutes I'll talk about. One second, I read that. And I'll go on to the next slide. Right here, just a last group of them. There's a welfare lien discharge, requested from the welfare official. The lien is being, discharged for map 112 lot 222 plot 007. Book 2165, page 1455. And discharge date would be the 27th of May, 2025. What has happened here is that a lien had been placed on the property from a welfare assistance, but there's no documentation of what that lien amount is, so we really can't charge anybody for it.
Yeah.
But the property is under sale and the deed has been reviewed and this lien needs to be lifted.
That's what came up.
Yeah, and probably what happened was the lien recipient has passed, and so usually what happens in those cases, the property transfers hands, there's no sale, there's no title search, anything like that. And so we kind of got missed at that point, but now.
We don't have any nomination.
Yeah, so we're just gonna discharge it.
Yes.
So I make a motion to accept the welfare lien discharge from map 112 lot 222 plot 007, book 2165, page 1455.
Second.
All in favor?
Kathleen, I.
Diane,
Laura, I.
Tricia, aye. And this just gets signed by me. And Kathleen and I each have both of office that we need to sign off on, so we need to be officially sworn in.
Planning board,
Yeah,
wanna do it? Can you do both of us at the same time? Sure. Read it. Raise our right hands.
is your right hand?
I, Kathleen Pelletier,
Do solemnly and sincerely swear
do solemnly
and sincerely swear
and affirm that I will bear faith
and affirm that I will bear faith
and true allegiance
and true allegiance
to the United States of America
to the United States of America
and to the state of New Hampshire,
and to the state of New Hampshire,
and will support the Constitution thereof,
and
will
will
support the Constitution thereof.
so help me God.
So help me God.
I
I, Kathleen Pelletier,
do solemnly and sincerely swear
do solemnly and sincerely swear
and affirm that I will faithfully
and affirm that I will faithfully
and impartially discharge and perform
discharge and perform
all the duties incumbent upon me
all the duties incumbent upon me
as ex officio to the planning board
as ex officio to the
Alternate
planning
official
board
to the planning board.
for 1 year,
for 1 year,
expiring on 3/10/2026.
Expiring on 3/10/2026.
According to the best of my abilities,
According to the best of my abilities.
agreeably to the rules and regulations
agreeably to the rules and regulations
of this Constitution
of
Of
this
this
Constitution
and the laws of the state of New Hampshire.
and the laws of the state of New Hampshire.
So help me God.
So help me God.
Thank you.
Woo! We're in.
Okay, for another year.
Thank you, Diane.
Thanks, Diane.
Thank you.
I have to sign some things, John.
Oh, wait.
That's one of them, signing. One or two things.
That really all.
Good eyes.
So John, are you gonna be reaching out to this?
They are getting in touch with us.
Oh, I see.
As soon as I hear, I'll send it out to the board.
Oh, yeah, you watch that too.
I'll take that out of the meeting. Wow.
Some days I do the, I think she realized now, not tonight. She's like,
Nothing more?
On here, we have, manifest 133, but I don't remember, I didn't sign off on manifest 133. So
That was from a week ago.
I looked through our emails and
All
didn't
right.
see one for it.
133?
Yeah. Keep all those emails and I didn't see one for that. So should I just skip it for now? Just to make sure.
I can't answer that question.
I'm gonna skip it for now.
Okay.
Well, what was on it? It's gonna cause
I
something.
think, yeah, that I don't know.
Okay, we have no idea.
You wanna see?
I know Veronica had sent a bunch, well, I'm back to May 17th and the last one I'm finding is 29.
Yeah.
And then the payroll.
Mhm.
My only concern is if you don't approve it tonight, it'll be 2 weeks before she can send out those checks.
Yeah, I know it's on.
It jumps from 129 to 130.
Oh, let me take it back, but then just stick it in my mailbox. I'll come in tomorrow
Is there a way we could get the information and just approve it by a right signature? Do we have to vote in a session on that?
Yeah.
Or can we just
I
sign?
mean,
If she
she's not
sends it
like
out
to
to
make
us
a
on the
motion to accept that.
What if we make a motion to accept it pending or after we receive it, Veronica will get it out to us tomorrow. If you have a concern, you could call and say,
Yeah.
stop the presses.
I would prefer to do that, that way we're not holding everything up. And there's a back door that you can take a look at it.
Yes,
I'll have her resend it,
okay.
if she hasn't already,
Okay.
I don't get to see the actual detail of the manifest. I only get a notification that it's gone out.
And I've noticed that some of mine don't always go to my main mail, so I'll have to check, like on my phone, I won't get them, but they'll come in my other mail in the Selectmen, I don't know
in the
what.
town.
Yeah, most of them will come through, but every now and then, one goes into that other and I have to like, oh, fish.
Junk mail.
Yeah, I'm like, what the heck,
Yeah,
this is a junk mail.
I went on the computer and did a search.
Oh,
for it,
did,
so I
okay,
didn't see
yeah, that's the only other thing that has happened to me.
Yeah, you know, yeah, but I mean, in my phone, I've got my never found yet,
Yeah.
but they must have pushed through an upgrade or something. Cause now, most of my stuff is in junk,
Oh.
most of it.
Yeah,
So
which
now
I
it's
was
just
thinking
I
should be-
default junk and that's.
Yeah.
I'll have her resend one later.
Yeah, okay.
All right, we're gonna make a motion that we accept the manifest 133 pending and our review and any edits.
Yeah.
Okay, and then I also make a motion to accept the manifest 134.
I'll second,
All in favor?
Kathleen, I.
Diana,
Laura? Tricia, aye. And I'm gonna make a motion to accept the town payroll manifest of May 29th, 2025. All in favor?
Kathleen, I.
Diana, Laura.
Tricia. And that is it for the consent calendar. Do we have a non-public today? No. All right, I'll make a motion that we join the June 2nd Allenstown Select Board meeting at
7:18.
7:17. 7:18. Yeah.
I'll second.
All right, all in favor?
Kathleen, I.
Diana, Laura.
Tricia, aye.
Hopefully it won't be 95 degrees and humid.
It's supposed to be 90 on Wednesday,
Wednesday.
Thursday, yeah.
And we'll.
Oh, we can get that AC.
We'll play this one.